It fascinates me how events happening long before we are born shape much of our lives. My grandfather was a villager from central Iraq. He was both progressive and problematic for his time. My grandfather was determined to have his sons and daughters complete their education, something he hadn't achieved himself. And that was not an easy choice by that time, because first, they did not have a school in the village to begin with, so my uncles and aunts had to walk long distances to reach the nearby school. Second, and more importantly, because it wasn't socially acceptable for women to attend the school at the time. And for that, my grandfather was bullied, he was pressured. At one point in time, he was cornered by his fellow villagers, by his relatives and neighbors to drop out his girls from school. My grandfather made a choice. He said no. That eventually paid off, as my mother became the first medical doctor from her village. Unfortunately, my grandfather did not live long enough to see my mother graduate, as he passed away during her final exams. I think a lot about my grandfather. I wish I could talk to him, just to ask him what was in his mind and heart when he made his choices. I want him to see how his values transcended our family for generations. More recently, I've been thinking about those who stayed in the village. When I was accepted into the Atlantic Fellowship for Health Equity and we were asked to come up with a health equity project, I thought that's the opportunity to reconnect with my roots. My health equity project addresses rural health disparity in Iraq. Throughout the past few months, I've been moving between rural areas in Iraq, talking to community health professionals to learn from them, to learn about their experiences, the challenges they face, and the barriers they encounter. This has been inspiring. I'm seeing in their eyes a spirit of service and a unique sense of dedication that is moving me to serve their communities, similar to the spirit of service we've seen while visiting Butaro, Rwanda, during our mid-year convening, talking to the community health workers. Very similar sense of service. Most of the stories I took from my visits are not stories of hope, unfortunately. They were stories of melancholy. One story that stuck with me the most was from a visit to a village, also in central Iraq, not very far from the village of my grandfather, around 90 minutes drive. The community health workers were telling me about the recent scabies outbreak in their area. They told me about the health education they offered to their people. I asked them about prevention. I asked them about containment measures. It was much later in that discussion that I learned of the severe water scarcity in their area. You see, the health system was offering people health education about personal hygiene practices while they did not have enough water. It wasn't because of a question I asked. It was mentioned accidentally and not in the context of the scabies outbreak. I remember following this encounter, I got into my car and I was angry. How come this was mentioned much later? I was thinking of the injustice we add to our people when we frame in individual terms what's clearly systemic, what's clearly structural. I was also angry that this has been going on for years. In 2023 alone, about 130,000 people in Iraq migrated from rural areas in search of water. Most of them will end up in urban slums, away from their ancestral roots. They'll end up in poverty, they'll be subjected to discrimination. So I was angry. And I'm not new to anger. I've known anger. When I was 9 years old, the US occupied Iraq. When I was a teenager, sectarian conflict erupted throughout the country. In 2014, 1/3 of the country was taken over by ISIS. I'm angry today because of the situation in my country and the assault on civil rights. I'm angry because of the state of the world at the time being. I know anger. I've wrestled with anger. I came to accept anger, to embrace it, to clinch over it. Because for me, I started to see anger as a protection. It protects me from feeling numb, from not being able to see all the wrongs around me. Anger can be resistance. It's resistance against injustice. But anger is tiring. It's exhausting. It's like carrying the weight of the world on your shoulders. When I applied to this fellowship, I had all sorts of reasons. To relieve the exhaustion from that anger was clearly not one of them. But I have to say that throughout this year, I felt lighter. I felt hopeful, and I felt optimistic despite everything that is going on. I didn't think much of it. It was much later when we had our session with Dr. Gary Bilklin, and I asked him how come he keeps going. And his answer was that being in a circle, connected around action, is the key. Thinking back, I've had that. I've had all of you, my people, and I want to acknowledge you for this. I want to thank you for all the love and care you've extended to me throughout this year, for creating this space of belonging, of community, of care, and courage. I want to thank you for giving me hope, lots and lots of hope. So my equity talk is titled History and Hope, and I took that from a poem by the Irish poet Seamus Heaney, and it feels appropriate to end my talk by reciting part of that poem. History says, don't hope. Don't hope on this side of the grave. But then, once in a lifetime, the longed-for tidal wave of justice can rise up, and hope and history rhyme. So hope. Hope for a great sea change on the far side of revenge. Believe that further shore is reachable from here. Believe in miracle and cures and healing wells. Call miracle self-healing, the utter self-revealing double take of feeling. If there is fire on the mountain, or lightning and a storm, and the God speaks from the sky, that means someone is hearing the outcry and the birth cry of a new life at its turn. It means once in a lifetime that justice can rise up, and hope and history rhyme. Thank you.